here at the top of the hour. Well, welcome everyone. Thank you so much for joining us. We are so excited to have you, especially at the beginning of the school year, which there is a lot of uncertainty. But one thing that there is seems to be good opportunity is in getting funding for your program, because health and wellness obviously is such a huge priority for our children and for our teachers right now. So we really appreciate you being here. I'd like to introduce myself. My name is Jen Ohlson. I'm the president of Interactive Health Technologies, and let me just get that slide here. Hold on. Whoops. All right, let me go back here. All right, and I'd like to introduce our guest speaker, our expert speaker, Sandi Cravens, who is going to really talk about her program. Sandi, if you'd like to introduce yourself, and then we'll introduce Eric Larson from our team after that.
Sure. Thank you, Jen, for having me today. My title is Health and Physical Education Coordinator for Irving ISD. So I'm in charge of curriculum, new programs, those kinds of things that we run in Irving, and then also support the teachers to the best of my ability.
Perfect. And we've got a great long storied history of working together and going after funding. So it'll be great to kind of share that. I'd like to also introduce Eric Larson. He's our Regional Vice President, former Denver Public Schools PE Coordinator and elementary teacher. Eric, you want to say a few words about yourself?
Hi, everyone. I'm Eric Larson, Regional Vice President for IHT. And like Jen mentioned, I taught elementary physical education for 22 years in Denver Public Schools, and then I was the Physical Education Coordinator for DPS for 13 years. And then I retired and decided to still work. And so for 3.5 years, I was the National Physical Education and Physical Activity Advisor for the Alliance for a Healthier Generation. And I've been with IHT going on 2 years now.
And again, I'm Jen Ohlson. I founded IHT in 2011 with my co-founder, Ben Benson. And it was really to provide and empower kids using technology. Today, we're going to really go through how you can secure funding for your program. So this is going to be very interactive. We'd really like you to ask questions. Sandi's going to go through sort of her firsthand experiences, and then we'll talk about some steps to go after that. And then we're going to provide you with a ton of resources. We're going to email this to you as soon as the webinar is over. So you'll have those resources at your ready with lots of documents that can help you get started tomorrow. So the agenda is going to provide some details on those funding. We're going to really start with ESSA Title IV, Part A, describe what that is. It's an annual funding allocation, and Sandi's going to talk about how she secured that funding for her program. We're then going to go into technology funding, how Eric and the Denver Public Schools secured funding in not only technology, but then we're going to go into the CARES Act, which is for COVID emergency relief. It's going to be it's very important. It's $13 billion that's just been infused into our schools. So we'll go into that in the CARES Act. And then we're going to talk about a funding roadmap. So we're going to provide you some resources, how you know the timeline, and just how you get educated and stay informed. There's a little Q&A at the top of your screen, if you can kind of see it up in the left-hand corner. Please use that as we're going to answer questions throughout, so we're not going to save them to the end. So if something pops up that you have a question about, we're going to have some pauses so that we can make sure to get to those as we discuss all the different aspects. The first thing I'm going to do is I'm going to talk a little bit just quickly, because we want to get to Sandi and her expertise, is about what IHT is. So our purpose is to really empower the health and wellness of kids through a daily, personalized, heart-centered approach. And we do that in a couple different ways. One is we have a wrist-based heart rate monitor, as you can see on my wrist here. It's called the IHT Zone Monitor. And it is a very simple product. It's the only product that's been developed for education, for K-12 education. It is also the top-selling monitor in education today. We couple that with assessment software so we can truly prove that direct impact to kids is making a difference, and allows our teachers to not only manage their classrooms, but also pull that data from the individual student to the teacher to the district, as Sandi's going to talk about, being able to look across her entire district to hold not only the kids accountable and motivated through the technology, but her teachers as well. We've got tons of curriculum resources. We have an online department for curriculum resources that we're going to share those resources for you. And then Sandi can talk about the professional development and how important it is to not just have technology and products, but to be able to have that ongoing support and the training so that the teachers can optimize them, especially when it's hard sometimes to get teachers to try new technologies or to integrate that. So we're going to talk a little bit about that as well. But for today, we're going to just kind of also tell you how the monitor works. So you can see on my wrist, my monitor is blue. That means I'm in a resting zone. So the direct feedback that the IHT zone gives is not just for physical biofeedback. Heart rate is actually the most precise and the most accurate way to provide feedback from an emotional standpoint. So when our kids are anxious, they're stressed, the first thing that happens is their heart starts racing, and then the mind kicks in. So if a bully walks onto the playground, the heart starts racing first, and then you think, okay, should I fight or flight here? So what our monitor really does is in the moment, real-time feedback for that student to be able to see where they are, and then to be able to self-manage that process. So they self-regulate their emotions, and then they manage that process through physical wellness in our physical education and activity classes. Yellow is that moderate zone, and then red is that high or vigorous zone. So it's a super simple product. Again, we're trying to really empower the students and put all of that into their hands directly. So that builds the autonomy as fast as we can, allows the teacher to then be the facilitator of the process. IHT is used in a lot of different ways in schools. It's not how you use the product, it's the impact that it makes. Right now, obviously, virtual and hybrid programs are on everybody's priority. And how do we help hold that accountability and kids motivated and allow that to be connected back to the classroom? So our online program is a perfect way to use the monitor. Sandi's going to talk about how she uses it in her physical education classes. We are also the Presidential Youth Fitness Program software. So we do PYFP and Brockport for our special needs population. Emotional self-regulation, we work with our school counselors, special needs, and then we have a new curriculum that's being developed where our STEM teachers, our math and science teachers, are using 1 to 4 monitors to help kids have a kinesthetic learning, which really helps them retain the knowledge, especially in math. So they're moving in an action-based curriculum using the monitors to help provide that feedback and the data back to the teachers and to the administrators. So let's get into Sandi and her story. And Sandi, I'm just going to sort of go put a question out here for you. How did you secure your funding? We'll start with ESSA and what that process was like. And this is Travis Middle School, one of your great middle schools that's using the monitors with your beautiful children.
Yeah, they've done a great job. Well, it started years ago. I asked our director of federal funding for if there was, because Jen and I had been talking about the heart rate monitors and her product and how do we get those into our schools. So I asked about title money years ago, and I was told, no, there's none for physical education and health. This is for core subjects only. So I said, okay. And so my director knew that I was looking for money. So when ESSA came along in Title IV, then he came to me to let me know that there was money now slated for health and wellness. And he said, if you don't need it, or if you don't want it, I'll give it to the nurses. And I said, no, I definitely want it. So I ended up meeting with him and talking with him. He had some parameters that I had to meet, and I came with some ideas, and he didn't like my ideas. It needed to be a new program. It needed to be something we hadn't used before. And that's when Jen and I started talking about how we could bring IHT and the Spirit system into Irving ISD. So it happened several years ago, and we've been building on it ever since. So I was lucky because I had already had that conversation with my federal funding director, and he So he remembered that, and then he came to me. So that worked out really, really well. If you haven't had that conversation, then that would be your first step, is find out who that person is in your school district.
Absolutely. Well, I'm going to jump really quick because people might be out there saying, what is ESSA Title IV? What is ESSA? And ESSA is the Every Student Succeeds Act. We used to have PEP grants, and Eric's going to talk a little about that. He's been very successful in securing about $7 million through PEP and other funding. But ESSA came about, it used to be No Child Left Behind. And President Obama said, we need to make this just, for every student. So it turned that money into PEP grants and a lot of other funding rolled into what's called the Every Student Succeeds Act. And it was really to make core subjects of not just math, reading, science, the STEM courses, but to bring music, arts, physical education into that core. Part of that ESSA funding was Title IV, Part A. And this is all about focusing on a well-rounded education. So how are we helping children in their physical, mental, emotional, and academic sense? So the funding is broken down, and we're going to talk about what you get as your state and all of that in just a minute. But basically, a lot of this has to go around safe and healthy schools, that well-rounded education, and technology. And as Sandi mentioned, it has to be a new program, something that the district doesn't have. And so just bringing innovation into your district and into your classrooms. There was a survey that was done, and just sort of when Congress created this Part A, lawmakers talked about the priorities of this. And so they really wanted to focus on, and you can kind of see here where superintendents and district administrators wanted to put that money. You can see physical education is right there, school counseling, SEL, and of course, making our schools safe and drug-free. So kind of, again, it was really wrapped around the physical, the emotional, and the mental of kids. When superintendents were asked in the same survey what they likely would invest in and how they could see an effective use of technology, you can see 3 down there: by digital devices, which is, devices like the IHT Zone, iPads, smart boards, things like that can help, again, create that learning environment in an innovative way. Blended learning strategies, which is right where we're at, spending time at home and at school, and bringing the classroom out of the walls of our school and into our home, which we're getting, a great opportunity to really build that into that. So ESSA Title IV allocation by state. So you can see here that the blue states are the majority of them. These states, like Texas, where Sandi is, are an equal amount. So if you're in one of these states, basically the allocation that you get, which I'm going to show you on the next slide, is broken into every school gets an equal amount. And they do a formula that's $20 per student per year. And Sandi's going to talk about how she got her first year of funding, had data to prove it. The federal grant director gave her another round and another round. So she's working on multiple years of this funding. It replenishes every July 1st. And you can see in the next slide of how it's broken down by state. Texas gets, I think it got increased last year from 1.1 billion to 1.3 billion. So this is last year's money. And if you can see your state here of kind of where you are and then what color you are, the purple are basically based on a formula based on Title I funding. The green and the yellow are based on competitive grants. So school districts have to ask for the funding at their education agency at the state level. So I'm going to kind of toss it back to Sandi on this and just kind of talk about, why don't you just, what you went in that first meeting, what did you have to have once you found out who the right person was? What were the steps in building your proposal?
Sure. He didn't want a lot of info. He didn't want a 10-page proposal. He wanted it, a 1-pager or 1.5-pager is what I turned in. He wanted to know what we were going to do. And it needed to be clear on how that would impact academics. So that was the key piece. And all of us in physical education and health, we already know that physical activity impacts academics, but those that are not in our field, they don't quite get that yet, or they may have heard it, but they don't believe it yet, or they have forgotten it. And so what I had to do was come forward with a proposal that is on this slide. I had to tell them what it was, why we were going to use it, why it's important at this level. And I felt that middle school was the perfect place because that's where they struggle. First of all, they've got their hormones are changing, their bodies are changing, so they're struggling with that. But also, after elementary physical education, you go to middle school physical education. They just needed something beyond the regular physical education class. It's there. We needed to start making them become self-responsible for their own health. And this heart rate monitor was definitely the key in heading in that direction. So I had to tell them why it was important that we used it. And of course, who was going to use it in middle school, how we were going to measure it. And, on my one pager, there's a little bit of information, but him and I talked about the zones and all those things so that kids could see where they're at in the zone. I had to lay out the key features, the budget, of course, how we were going to make it equitable. That was one of the key things because I'm in charge of 8 middle schools. So I had to figure out how can I make sure it's equitable. We only had enough funding to get 20 monitors in the first round. So we had to ensure that the kids that were going to be using it, it was in a cyclical situation so that if you didn't use it one day, you got to use it the next because we just didn't have enough for everyone at first. So, and then I had to lay out, of course, the benefits of how it would be or to the students from use. And like I said, he didn't want a lot of information. He wanted it to be easy to read through. And after we sat down and talked for 30 minutes or so, and he was thrilled. So we moved to the next step, and I was able to get the funding and move through the process.
Perfect. We do have one question based on the difference between ESSA and CARES, and Eric's going to jump into that. So thanks for setting that up. Well, I have a question for you. So how long did you spend with him? Did he see this and was this, like he had a think about it, or did you frame it in a way based on the knowledge that you have that he was like, this is a go right away?
Well, I met with him once and I came with some other ideas that they weren't bad ideas. They were just additions to other programs we had going. And he said, no, we want something new and it needs to be clear and measurable. And that's one thing that the heart rate monitors do so that we can show that it's impacting student health and academics. So at first he didn't like what I had to propose. And then when I came back with that proposal and I will say one thing that I did do also is I met with the middle school teachers before bringing that proposal to him because I knew I needed some buy-in from the teachers. Since it wasn't just one school that was going to use it, I needed to make sure that all the schools were on board. And then I created that proposal. And I answered all his questions in a quick way, very succinct way. So he said he approved it right away and away we went.
That's fantastic. Well, let's get into the steps. There's some real key steps, and I'm going to just kind of walk through these on each slide. One of the first things you mentioned was to have a strategy. And if you kind of can just explain what that means.
Well, I needed to make sure that, like I said, that we started with just meeting with the teachers and making sure that we had, for the most part, some buy-in. And because I didn't want to do all this without them, going, well, we didn't want to do this in the first place. So once I got that, then we started, like I said, with 20 monitors. And with the vision or the goal was to add to that each year, because in my discussion with our federal funding director, he mentioned that, there will be funding if it goes well year after year. So our goal was to get, 20 monitors to start with, see how that went, and then go from there. Luckily, we had some key teachers, which will probably happen in other districts as well, that took it and ran with it. And I had emails and texts right away about how it was going in their classes and the response from the kids. And that made that made others want to jump on board too, because you've always got those teachers that, yeah, they're not so sure. And so just sharing the stories from others. So that made others say, oh, okay, I guess I'll give this a try. And then our vision was each year we'd add more monitors, and then we would also add more training to the monitors as well. So just kind of revisiting, and that was our plan this year until COVID hit, of course, is to do. They are going to talk about it a little bit, but we're not bringing your folks in. We're going to wait a year and bring them back, since we're not sure what school's going to look like. So
it's as clear as mud, as they say.
Exactly.
So,
yeah.
Talk about just educating yourself. Was this a learning process for you? And how did you focus on looking at your district's improvement plan to start, or what was that process like?
Yeah, well, the district improvement plan is always, about helping children increase their academics, of course, and health and wellness, or the well-being of students is going to be in your district improvement plan, probably. So those two things, absolutely, we meet that criteria right away. So if you can use that language in your proposal, that would really help. If you can even state, where to find it in what strategy or the section of the district improvement plan or campus improvement plan, whichever one you're using, that's going to help as well. So yeah, we talked about that. We made it, one of our focuses to make sure that we were meeting the plan where the administrators wanted it to be.
In the last bullet you have here, I think is really important. Start asking questions. And why is that important for our audience?
One thing Jen and I talked about this morning is as physical educators and health educators, sometimes we kind of are taught, or we feel like we're not deserving of the funding or the money that is out there to support us. And so we don't ask the questions. So the first thing that you need to do is start asking about ESSA, Title IV, find out who is the person in your district who is in charge of that money, and or go through the chain that's needed. If you're on a campus, go through your principal and up the chain, and frame it in a way that's not threatening. So something like, hey, I've got a great idea to help increase academics through using technology and heart rate monitors. And I understand that there's some title money that's available targeted for health and wellness. And who would I talk to get some of my questions answered, or to see if I've got access to that funding. So in a way that's, people, they want to know more about what you've got in mind.
Absolutely. And kind of one of the last questions I want to ask about is the technology. So making sure that it's a fit. So instead of getting something and trying to wedge it into, how do schools decide and make sure that the technology is compatible with that? Is that important?
Yes. So anytime you purchase technology, it's got to go through a process of being approved and make sure it's compatible with your district system. And I'm assuming that every district is that way. So that would be your first step, is just making sure that the technology is compatible and that it's approved through your technology department. And then once you get that step completed and approved, then you can move on. In Texas, we have to use an approved vendor. And, we worked with Jen in our purchasing department to do that. And it's important to start early, because this process takes a while. We didn't get our funding until January, and we started thinking about this, talking about this in the previous September. So it took us about 5 months or so just to get the funding and the purchase and receive the equipment and all of that. So it can be long, drawn out process, depending on who you're working with and how busy they are, I guess you could say. So
I'm going to pull up the next slide. I just Googled your website here. This is Irving ISD, and I just Googled in district improvement plan. So when you're looking at this, just Google that for your district. And a lot of schools here in Texas, we have campus improvement plans, as Sandi mentioned, but it will give you, like she said, the language. It'll be right there on what the district is trying to do this year. In the past years, you can see here on the side, the district improvement plans for every year. Most districts have this. So this is a great way to, again, try and understand and speak the language of those. And then as Sandi mentioned, don't wait to the last minute. This is the perfect time. And if you get in line right now, that funding just replenished July 1st. So it may, as we said, with COVID, be a wait because we've just got our hair on fire as a country and in our districts. And so this, but if you get in line now and get in the queue, it will come. And as Sandi, I can't reiterate it enough, is that you got to have the courage to not take no for an answer and keep going after it, because there is a lot of money. And I'm going to show you exactly how much when we get to the end in our resources. And the last thing is when that money needs to be spent. And so can you just talk about, was there a deadline or did you feel rushed to get, some data? And what is the competition like? Because I know ESSA, there's a lot of competition out there. You mentioned the nurses, but talk a little bit about the timeline on this.
Well, if you can come prepared with your idea and your proposal or a rough draft of your proposal, then you're more likely to get the funding. In my case, the funding was allotted to me if I could meet their expectations with what they were looking for. In a bigger district, you might be competing with some other areas, but that Title IV money that is slated for health and wellness. So as long as you can show that that's where you're going to use it, then you should have a pretty good chance. But definitely urgency it's always good to get in line, like Jen said, and let them know you're interested. And because they don't know unless you speak up and, come in with an idea, a strategy, a plan, and that way they're going to listen to you and then remember that you're looking for that funding.
Perfect. Before we get into some questions, I just have a couple more for you. Have you accomplished your initial vision? And what's next in regard to outcomes and using the data to drive your program forward?
I would say that we're still in the process of accomplishing our initial vision. I didn't want to start out being the gotcha person. I encouraged them to use it with at least one class. And then the next year I set the expectation a little higher, and then the next year a little bit higher. So we're getting there. Last year I expected them to use it with every class. I can't say we were 100%, but a lot of schools did meet that expectation. We've had some turnover. We've also had various campuses with teachers that were out with illness or pregnancy. And so that makes a big difference too, if you've got a sub in there. So we're getting there. And then of course, once COVID hit, we weren't able to continue for the rest of this year, but it's a work in progress, and I'm just trying not to get discouraged. I don't penalize anybody, but we're to the point now where, we'll have to, not tattle on anyone, but just firmly remind them of the expectation, and we'll see how that goes. Now, as far as regard to the outcomes using the data, we're to the point now where we're using them consistently enough that I can go in and see how much they're using them, how the students are doing, how much time is spent in the zone, so to speak. And one thing that we haven't used a lot, but we're getting there, is the middle school teachers are very competitive. So when they see Travis Middle School have this many minutes in the zone, another school wants to either beat them or at least meet that. So we're using that data. At the end of the very first year, I did some comparison or some correlation, And we found that those that were using the zones were passing their classes. So at 92% were passing. So we're able to make some of those statements as well. So it's a work in progress, and you're never quite finished, but we're getting there.
That's fantastic. It's been fun working with you.
Yes.
Well, go ahead. Sure.
I was going to say one thing that I haven't mentioned, maybe just a little bit, I've mentioned it. The response from the kids has been the big thing that has driven this program forward, because when I went over to see how the kids were doing with it, I mean, I'm getting goosebumps right now just talking about it. Some of the kids that didn't want to move, they put that monitor on, and they weren't necessarily, at the winning whatever it was, or at the top, or the first to do whatever it was they were doing, or the best, but they were motivated, and way more motivated than they would be without that monitor. So, and the kids loved it. They even asked about, do we get to keep using them? Because they thought it was going to be just a one-time thing and then it'd be gone. And so the reaction from the kids and the response has been the huge thing that has kept us moving this program forward.
That's fantastic. I think we do have a couple questions, Eric, you said in the chat box.
Yes, Jen, I think I'll have you answer this one. And the question is, a school has 44 monitors and they're looking to go one-on-one initiative. And they want to mirror Chromebook initiatives, and they want to go fully remote. So if you could talk about that just a little bit, that would be great, Jen.
Sure. So the monitors, obviously, Sandi's talked about the success within the traditional school day. You only need as many monitors as your largest class. So if your largest class, Sandi's 80, Texas is massive classes. But so, this monitor is numbered, if you can kind of see that. And I wear it period 1, Sandi would wear it period 2, Eric 3. The monitor goes 6, 7 kids a day if you're using it in athletics or before and after school programs. With the app that we have, and I'll just kind of pull this up, but we do have a mobile app. It works on smartphones and also on Chromebooks and on iPads. And this will basically work perfectly if you are one-to-one on Chrome. This is a great way to complement that. And we've got some great articles. Jay Plotkin, when he sends you the resources, is going to send you some of our success stories in the virtual learning environment, schools that have gone both in class and online. Des Moines Public Schools uses us district-wide, and they've got a virtual academy, as well as Poudre Public Schools in Colorado. So we'll send those 2 articles just so you can kind of get a sense of it. And it's super easy for the kids. So they'll turn the monitor off. It'll just turn, you can kind of see my monitors getting turned off right here. And as soon as that happens, the kids will get a smiley face where they can kind of answer how they're feeling, and there's a journal entry. So it just gives a chance to use the zones. The cool thing is that all that data is then connected back to the classroom. So if I'm a physical education or a counselor, I basically, if I have 300 kids, that data comes back to my central, they're connected to your classroom. Eric, I don't know if that answered the question.
Yes.
Okay, perfect. And
another question, Jen, before we move on, is does the heart rate monitor reader that the kids use tap in and work with the Chromebooks? So I think you explained that you do it with the app. So hopefully we answered that question also. And is there any anecdotal evidence of improvement in behavior issues?
Eric, you could probably take that one with our Littleton Public Schools if you want to.
Sure. So in Littleton Public Schools, we've been using the heart rate monitors for all day wear. And they started with one school, East Elementary School, and now they're going to go to 16 schools this coming fall. It was so successful. And so the students wear the heart rate monitors all day, and they have seen a huge drop in behavior referrals. And so they were 3 years ago way up there with their referrals, and they've dropped, I think this last year, it was amazing. They had 3 referrals because they have the kids wearing the heart rate monitors all day. that have self-regulation issues. So they learn to self-regulate. It's a behavior management program. The feedback is right there on the heart rate monitor because they can see their heart rate go down through belly breaths or whatever strategies they're working on. They also can see when their heart rate is up into the moderate zone or red zone when they aren't doing physical activity. So the spikes are coming because they're angry, they're anxious, and so then they self-regulate. And so we are now going to, in Colorado this next year, we'll be in 23 schools total using the heart rate monitors for self-regulation.
And I think one of the questions but I looked at just a little more detail, like, is it a good idea to go one-to-one, just like schools are one-to-one in their devices with tablets, Chromebooks, and iPads? Is it a good idea to have one-to-one heart rate monitors? One of our superintendents that we work with, when he sort of described what IHT is in a one-to-one personalized learning environment, he said IHT is the Chromebook of wellness. And so this device, there's a lot of things that we purchase, curriculum, professional development for teachers to get better at the teaching and learning. But this is a direct impact in the moment, in real time, impacting that student's mind, their behaviors, their emotions. And so it's a great complement, especially when they're at home, missing those elements of that social and emotional and physicalness with their classmates. This is a great way that connects to them in a way that they understand. And then it, again, provides that teacher the ability when they can't see them every day in hybrid or virtual programs. So we really have a lot of schools that do purchase one-to-one, and the benefit, as Eric just mentioned, the success, Sandi after 1 year was able to get that funding again because it's data, and education is demanding data. And when we can provide that in a really simple way to show improvement in student growth, the funding will continue to come. Now we're going to head to Eric, and Eric's going to talk about we're going to answer that question about the difference between CARES funding and ESSA, and he's also going to talk about some other funding that's out there, starting with technology. And Eric, if you want to take it from here.
Sure will, Jen. So right now, the technology funds are being established the timelines are being established for the school year. So schools are looking at the needs of schools. So this is an ideal time to make any requests. Get to know your IT person in your district, the IT director. When I was with Denver Public Schools, we were able to get 3 PEP grants for high school. And that PEP grant for high school, we applied, or we made sure we included heart rate monitors in the PEP grant proposal. And we received the PEP grant, and so we had to work with the IT director to make sure that we were meeting all their guidelines and collecting data and everything else that you do. And so I got to know the IT director. And after those PEP grants were over, I still had that good relationship with the IT director. So we would be in the first semester, in the second semester, and he'd come to me and would say, you know, it looks like we got a little more money available that we can use for physical education, for technology. Do you have a need? Well, of course, I always had a need. So just developing those relationships are really important. So this is the time of year to make sure that you're checking in if you're in a building with your principal, your administrators, asking those administrators who you should talk to in the district about getting funds for technology. Now, here's the deal with the CARES Act. So the CARES Act, and there was a lot of questions in the question answer section. So any activities that were funded by ESSA funding can be funded by the CARES Act. And there's a list of those that can be funded. And the ones that can have an impact for physical education and health are those activities that can be funded Title I, Title II, Title IV-A. And then the other part of that, so physical education and health fits into ESSA Title I, Title II, and Title IV-A. So any of those that were funded previously by ESSA can be funded by the CARES Act. And the other part that can be funded by the other two areas that could make an impact for physical education and health is purchasing technology. And that's the hardware, software, and connectivity for students to connect with their teachers. And it also is for adaptive devices and equipment. So those two areas, along with provision for mental health services and support. So we were talking about the SEL, social and emotional learning aspect of using the technology, using the IHT heart rate monitors. So that fits into that area also. Now there's some areas in the CARES Act that do not pertain to physical education and health, but these do. And what I recommend is Shape America has done a great job of breaking this down. So if you go to their website and you bring up CARES Act, they break down what areas can be funded in the areas of physical education and health by the CARES Act.
So Eric, let's talk a little bit about just kind of, you got a slide on just knowing the key players in the district and give some advice on who to go after and your strategy in that.
Yeah, and I talked a little bit about knowing the district technology director. Of course, the director of curriculum for the district is very important. Some districts have a physical education coordinator, the larger districts. Some districts do not, so they have a director of curriculum. So it is good to get to know those people. If you go back to that slide, just a little, hold that slide a little bit longer there, Jen, because I want to cover a few of the other areas. And just some examples of knowing the wellness coordinator in the district. In Denver Public Schools, I had the wellness coordinator come to me, and she said, you know, we have a chance to get this health diversity grant from the Colorado Department of Public Health and Environment. And you're doing some great work in the area of MBPA. And here's their benchmark: obesity risk factor reduction. And so can you put together something with moderate to vigorous physical activity, the students meeting 50%, and put that in this grant with the objective, with the benchmark that they have as their obesity risk factor reduction? And I said, sure, we'll give it a try. Well, this has never been done before in the state of Colorado, a physical education department applying for this grant. So we went for it and we got the grant, $750,000. So it just tells you that even when a grant opportunity, a grant application maybe doesn't quite fit, those people reading the grant applications, it might fit for them, because we're showing that our students are going to be engaged moderate to vigorously 50% of the time, and that's going to make a huge difference in the obesity risk factor reduction. So another example of connecting with the wellness coordinator. And then we were able to, in the wellness policy, include that benchmark that for Denver Public Schools, all students should be engaged in 50% moderate to vigorous physical activity in physical education class. So we even made a difference in the wellness policy by having that connection. Make sure you know who the grant writer is for the district, because a lot of times the grant writer is the same person that is going to be handling the CARES Act. That grant coordinator, it's the same person that's going to be handling the ESSA funds. And so the protocol to reach out to those people, start, as Sandi mentioned this, start at your building level, find out the steps you should take. If you're at a coordinator's level, then you should be able to reach directly out to these people. And then look at other possible funding. Medicaid funding. When I was with DPS, I worked with the OT PT department, and we are able to apply for Medicaid funding. and get adapted physical education equipment for all our elementary schools. And then we are also, with that funding, able to get the heart rate monitors for the special needs students. So the way I look at it is look at all opportunities and think sky's the limit. Along with the mental health and the SEL opportunities out there, I mentioned those earlier, but that can also be in Poudre School District. We are pairing up physical education and the school counselor. One day out of the week, every other day, the physical education teacher is using the heart rate monitors for physical education, and then the alternate days, the school counselor is using the heart rate monitors for social and emotional learning. So we're going to stop right now and see if there's any more questions about the ESSA funding or CARES Act funding, or questions that you have about connecting with coordinators in your district.
We do have one question. It's about the longevity of the monitors and how long you can expect them to be used in the school before they need to be replaced. I'm going to answer my side, and I'm going to have Sandi answer this question as well, because I'm going to tell you one thing, and she's the end user and the experience. We did have a 1-year warranty. We've now moved that to 2 years. We spent about 18 months building this monitor with our partner Adidas. And so we sent physical education teachers over to Germany to their headquarters. This is the only product that's specifically made for education. One of the biggest things was, we know that kids love things differently than we do, so that this was going to get slammed into walls, dropped on the floor. So we tried to build a product that was as sustainable and long-lasting as possible, because we know budgets come, maybe once every 10 years we get big purchases. That was Des Moines. Every 7 years their physical education budget came, and so we needed to make it last. Now, that is not to say we haven't been without issues with it. We've had to redesign our strap. And Sandi, could you just kind of talk from a consumer standpoint of the experience with the monitors, replacements, and using the monitors, I think for now going on 3 years?
Sure. Yeah. The monitors have really held up pretty well, considering the amount that we've purchased and have had to have replaced. Of course, IHT has been great to work with. The biggest thing that we've had issues with, like Jen mentioned, was the strap, because we had some of the first generation straps. So they replaced those at no charge, and just to get us with the newer strap that worked a little bit better. One of the bigger things we've had issues with, and this seems to be, some schools have issues and others don't, is the little pins that hold the strap to the actual watch. And, but again, it's a nominal fee to get a bag of those pins, and then I just send them out and the teachers fix them, as needed. And anytime a monitor goes out, you all send us a new one, but that hasn't happened that much. They have glitches here and there, and you replace it with no problem. So most of them have been pretty durable. And again, sometimes the teachers will put it aside if it's not working well, and then we contact your company and you say, let it die all the way down and then recharge it. And a lot of times that takes care of the issue. So there's been some fixes along the way that have helped us too. So really, we've been very pleased, to tell you the truth.
And we've learned a lot, when you build something, even if it's in Adidas's headquarters, we didn't know when Adidas first built this. We thought those pins, a kid would get their hand tapped in it and it would hurt them. So they made the release of it. So we've actually strengthened those. So any, we've kind of learned and built new and learned. The monitor itself is when we put new brains in it, which we are having new firmware, it's called. We're making an update right now in the next week so that when schools go back, so if you bought this monitor 5-6 years ago, you're always going to be on the latest innovation IHT has. You just put it on the little data reader and it will upload the new innovation that we've got. Our software is all cloud-based, so you're always on the latest version of that. And our assessment software is a whole nother side. That's not this webinar, but if we don't have any other questions, I will, or do we have any other questions, Eric or Jay?
You've covered them, Jan. I think we're up to date.
Perfect. Well, let's just talk about now, how can IHT help you? So again, when we hang up on the webinar tonight, we're going to provide you with a lot of resources. The first that we're going to provide you with is going to be our 8-page ESSA ebook. Now, this is going to basically take you through, I think there's a case study in there for Irving Public Schools, Sandi's story that she's told today. It'll be a recap of that. There'll be other success stories. There'll be the funding, the map that I showed you, the funding allocation, and that's going to give you a good chance to just kind of have a review of this webinar. And again, the steps that are needed to take it. We also have a school mental health roadmap, and this is a really good guide. If you're looking as a physical education teacher and you're like, my school's all about SEL, it's about mental health or emotional health, work with your counselor and say, hey, I'd like to go in together. Let's get a set of monitors for Burleson ISD just next door to Irving. The PE teacher really wanted the monitors, so she got a set for physical education. The counselor got a set of 4 to 10 monitors, and then everybody basically is working on that whole child approach. So that's going to come your way as well. The funding ideas template that Sandi shared earlier, the one that she basically used, this is on 2 pages. There's a 1-pager that's going to just, again, the who, why, what, where with the budget on it. Now, if you're wondering like, okay, I'm interested in this, I need to know what the cost is, that's always the start. Reply to that email and reach out to us, and just to have in hand, we can get you a quote just so we can see what the cost is and then what we need to go after. The other things that I want to mention that are really, really important are, and Sandi, you can maybe talk about this after I talk about getting into the social media, whether it's Twitter. We have a community called Phys Ed Chatter. It's all of our customers, and you can basically kind of learn about that. So we encourage you to get involved with those online networks. And as an administrator, the Texas administrators are just amazing. And can you just talk about the importance of the group that comes together in Texas to, again, unite in a centralized, harnessed way?
Yes, so we have our North Texas coordinator group, Health and Physical Education coordinator group, and we meet 5 times a year. That gives us a chance to meet face-to-face and share ideas. Other avenues would be Twitter, Facebook, those kinds of things. If you're not able to meet face-to-face with folks that are doing the same thing or interested in the same things that you are as far as programs and curriculum and that type of thing. So we, like I said, we're fortunate. We get to, and Jen even comes and talks to us sometimes, but several of our teachers do use Twitter. Teachers are really into Twitter. There's so many great ideas and so much information. So they'll tweet out a picture of what's going on, and certainly anybody can reach out for more information. So yeah, using any avenue that you can to learn more about what other folks are doing, that helps you answer questions when your funding director wants to know more.
Absolutely. And if you go to IHT USA, we've got an incredible blog. I want to give a big shout out to Jay Plotkin. He's behind the scenes, making sure our technical side of our webinar is, but Jay's also our content manager and our director of marketing. And so to go on there and read stories like this, just go on to IHTUSA.com. There's a resources, and the first tab is our blogs. You can find Sandi's story on there about how she found the funding, McAllen, Mission, Humble, a lot of our districts, Kamal in Texas and around the country, how they've tapped into that funding. Also, we really encourage you to follow Shape America and your state AFERD. Just become a member and just stay involved. As Eric mentioned, there is a ton of resources. Carly Satterwhite does a great job. Carly Wright does a great job of the advocacy side and explaining all of this in really easy terms. And then you've got a whole toolbox with that as well. Get on the your state's Department of Education mailing list. This next slide that's going to come up is basically from the Texas Education Agency. This was today. It came out. You can see there it says August 3rd. And this basically was all of the current ESSA funding, the revised plan for 2021. And if you click that bottom arrow there where it says entitlements, I went through, and this is Region 10, and you can see Irving there. The first column is Title I Part A, Title I Part C. So the first ones, you can see the most money. There's $9.4 million in ESSA funding being infused into Irving ISD. The last column on the right is Title IV Part A, and that's $730,000 a year that goes into this. There's certainly money that you could go after. The formula, again, you can see down the bottom, the way that those states are split very equally is $20 per student per year. So whatever your district enrollment is, times that times $20, and that's pretty much an idea of what type of Title IV funding that you've got. There's some other great resources that this webinar will be sent to you, this slide deck. There's a school specialty does a great job of a grant tool finder. Just put in your state and some keywords, and you'll find some outside grants from hospitals, like Eric had mentioned, Blue Cross Blue Shield. So you'll find some outside grants as well. Follow Twitter. These are some great Twitter handles: EdWeek, Shape America, obviously at IHT Spirit. And so follow those, and you'll see some trends, and you'll see other people and how they're doing it. So we're going to finish here as we kind of get to the end of our session with any other questions and just some final comments. Sandi, just any other advice that you'd like to give our audience as they sort of dive into this and to trying to secure their funding?
I think I've covered a lot of it, but I guess the biggest thing is don't give up. Don't take no for an answer. We're conditioned to think we don't deserve it in health and physical education, and we do, because we're the foundation for learning. And the more we can spread that word and back it up with documentation and resources and data, of course, then the more chance you're going to have. So, and keep it small. I learned from talking to others, including Jen, start out small, and then you can build on that. Going too big, of course, you're going to end up, struggling. So just try to start small, and the word gets around. Teachers talk, kids talk, and parents talk, of course. And, just have patience, I guess.
Great advice. Eric, any final thoughts?
Yeah, I would just say that to develop those relationships and start the conversations. Sometimes we're afraid to start those conversations because we're afraid to be turned down for grant funding, or, oh, it's just not going to be worth it. I'm going to put a lot of work into this and I'm not going to get anything out of it. But start the conversation, see where it goes. Remember the impact that you make working with your students. It's a tremendous impact that we make in the areas of health and physical education. So keep up the great work.
And IHT, because of the need, we're going to have a webinar series, sometimes twice a month or once a month for sure. Our next webinar is going to be on 2 weeks from today. It's Monday, August 17th. We'd love for you to join it. It's going to be talking about those online and hybrid programs. The one after that is going to be social emotional learning and looking at some of those districts that are using it for that emotional regulation. So keep an eye on that, and we'll send out information. And we also want you to reach out to us. Our emails are here. If you have any other questions, please, Sandi, I know you have been such a good resource to other districts, and just that is very important. I know that you've got a good network, and having people reach out, I know is a big key, and just kind of getting some more advice.
You bet. Happy to help if I can.
Well, thanks, everyone. We appreciate it, and you have a great start to the school year. Thank you for all you do for children and their families, and we appreciate you guys being a part of our family tonight.